So this PowerPoint contains few common questions and answers that frequently asked in NCLEX licensing exam. It gives few tips on how to answer the question that are likely to be answered or asked in NCLEX board. Let's work together and to help to pass the NCLEX licensing exam. If you need more information, just email me here. I am happy to assist you. The first question here, a nurse is assisting or assessing or assessment the abdomen of a client who has suspected appendicitis and was admitted to the emergency department. Identify the area of the abdomen that the nurse should palpate the last, right? So the examiner asking, your patient have a appendicitis, means inflammation of the appendix. So we have to know where actually appendix located, inflammation that area. When you palpate, you should palpate last, right? So you have to put here, this is the area. Like this picture can help you, right? So you see, this is the appendix. The which area located? Right lower quadrant or right iliac region. The organ located here, appendix and cecum. This is the terminal portion of small gut called ileum, cecum start, large gut. But when the inflammation of the appendix, a finger-shaped projection present at the lower right side of the abdomen, right? And start with a dull pain in the middle or right side of the abdomen, we call it appendicitis. So examiner asking where actually it is. It is this area. When inflamed this area, when you palpate, you have to palpate last, right? So rational said, an acute attack of appendicitis localized as a pain and tenderness in the lower right quadrant. Midway between umbilicus, this is the umbilicus, and the crest of ileum. Crest of ileum is here. So midpoint is called McBurney's point, where actually the appendix. So this area should be palpated last in order to determine if the pain is also present in the other area of the abdomen. So it is last we could palpate. So this is the picture showing abdomen is divided into 9 areas, right? So like right hypochondriac region, usually liver, gallbladder, and part of the small intestine is there. So if patient have a liver problem, this area inflamed will be pain first. Right lumbar, part of the gallbladder, part of the liver, and right iliac, we already said, appendix and cecum. Epigastric region, stomach, part of the liver, pancreas, duodenum, spleen, or adrenal glands. Umbilical area, particularly umbilicus, and part of the small intestine and duodenum. Hypochondriac result, urinary bladder. So if patient has a urinary bladder stone, pain will be here, suprapubic or hypochondriac result. Also female reproductive organ like ovary, uterus, left hypochondriac, spleen, colon, left kidney, part of this, and part of pancreas. Left lumbar, said, descending colon, and major organ is the left kidney. Left iliac, descending colon, and sigmoid colon. So if patient has a tumor in the sigmoid colon, definitely pain start left iliac area. Next question. So a client comes to the clinic for diagnostic allergic test. The nurse understands that the intradermal injection are used for such testing based on what principle? The key word is diagnostic allergic testing. So diagnosis and test. So we do the blood test for allergies, and allergy blood test detect and measure the amount of allergy specific antibody in your blood. When you come into contact with any allergy trigger, your body makes antibody against it. Like food allergy, one of the common allergies in the people's test we do, like a patient came to you for food allergy testing, and testing is the most controversial aspect for food allergy treatment. Whatever it is, examine asking here. So for the allergy test, we decide intradermal injection. Why you decide intradermal? Why not you prefer intramuscular or other route? Number one, intradermal injection is less painful. Intradermal drugs are easily to administer. Intradermal drug diffuse more rapidly, and intradermal drugs diffuse more slowly. So what are the principles that you choose intradermal? The correct answer is intradermal drugs diffuse more slowly. What are the rationale? So before to go rationale, you can see the type of injection. This one is the intradermal. So the needle come up to the dermis, up to, not touch the dermis, just before. Intravenous, blood come up to the blood vessel. Subcutaneous, you see the yellow layer, subcutaneous layer. And intramuscular, in the muscle, 90 degrees. So most rapid intravenous, and slowly go in intradermal, slowly. The rationale, drug administered intradermally diffuse slowly into the local microcapillary system. Slow diffusion is necessary during diagnostic allergic testing because rapidly introducing an allergen could cause a diffuse threatening allergic reaction in a sensitive client. The areas of administration and client comfort are not principal taken into account when using intradermal injections for allergy testing. Next question. Which factors are major component of a client general background history? Number one, allergies and socioeconomic status. Number two, urine output and allergies. Number three, gastric defect and client aging, bowel habit and allergies. So examiner asking that question here, the client general background history. But here urine output, it is actually related to diabetic, kidney disease, right? Organ related. Gastric reflex, organ related, stomach problem, esophageal problem, duodenal problem, bowel habit, GIT problem, but not the general background of history. That what is the correct answer? They said allergies and socio-economical status indicate the general background history, right? So the medical history or case history of a patient is information we gathered by physician or healthcare provider by asking specific questions, either of the patient or of other people who know the patient and can give suitable information, right? And our aim of obtaining information useful in formulating diagnosis and providing the medical care to the patient. This is the importance of history takings. The rationale said, general background data consists of sound component as age, allergies, medical history, habit, socio-economical status, lifestyle, or sensory deficit. But urine output, gastric reflex, bowel habit are significant only if a disease affecting this function is present, right? Next question. A nurse is caring for a client who has experienced an acute exacerbation of Crohn's disease. Which statement best indicates that the disease process is under control? So what is Crohn's disease? Crohn's disease is a chronic inflammation of the digestive tract that leads to abdominal pain or severe diarrhea, fatigue, weight loss, and malnutrition, right? So they said if we proper diagnosis of the disease, and after the diagnosis, when you give the treatment, usually treatment include the medication, nutritional supplement, or sometimes patient needs surgery, right? And treatment option depends on the location and severity of the disease. Whatever it is, out of 4, which one is indicate the disease is under control? Number 1, the client exhibit sign of adequate gastrointestinal perfusion. Don't read perforation. Perfusion means enough blood supply, enough movement, peristalsis, everything is okay. If the cone disease is perforate, means complication develop. Number 2, the client express positive feelings about himself, right? It is psychological answer, number 2. The client verbalized a manageable level of discomfort. Number 3, the client maintained the skin integrity. The correct answer is the client exhibit sign of adequate GI perfusion. The rationale, adequate GI perfusion can be maintained only if the cone disease is controlled. If the client experiences acute uncontrolled episode of cone disease, impaired GI perfusion may lead to a bowel infarction. Positive self-image or manageable level of discomfort and intact skin integrity are expected client outcomes, but are not related to control the disease. Here a picture. We see the Crohn's disease and ulcerative colitis. As I told you, Crohn's disease is a chronic inflammation of digestive tract that lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. Ulcerative colitis, it is the condition as like as Crohn's disease, GIT inflammation occur. Also, ulceration of the colon, particularly descending colon and rectum. So it causes the stomach pain or cramping, right? So here we said the first picture, Crohn's disease, and second picture, ulcerative colitis. You see which red area is easily get involved in the disease. The other picture I want to show you. So here you see Crohn's disease, ulcerative colitis, or diverticulitis. All of 3 is a chronic inflammation of gastrointestinal tract. So what are the different location of the gut get involved? Like Crohn's disease, terminal ileum, cecum, ascending colon get involved more. Whereas the ulcerative colitis, terminal part of the colon, descending colon, and rectum, sigmoid colon get involved. What is diverticulitis? Diverticulitis also inflammation and infection, but you see extra sac or diverticula formation in the gut. And this sac or diverticula inflammation occurs. Why? When food get in, food not come back. or infection occur, inflammation in diverticula, we call diverticulitis. And here showing normal picture of our gut, appendix, terminal ileum, cecum, it is called ascending colon, then transverse colon or only colon, descending colon, and rectum. Next picture here showing inflammatory bowel disease, right? Another keyword. Inflammatory bowel disease, basically Crohn's disease, diverticulitis, and ulcerative colitis. All combinedly you can tell inflammatory bowel disease. It is called IBD. But here you see IBS. IBS stands for Irritable Bowel Syndrome. Irritable Bowel Syndrome. So if common question and NCLEX board asks that I provide here, what are the food we could avoid in case of irritable bowel syndrome? So irritable bowel syndrome, a chronic gastrointestinal disorder that affect the large intestine and causing the diarrhea, abdominal pain, abdominal cramping, or bloating, right? Most common. So sometimes some of the food increase this problem, right? Particularly, there is no specific test to diagnose IBS. Medical history and physical examination is done, and tests are carried out to determine other causes. So when you give the treatment, usually treatment is relieving the symptoms. It cannot cure, and it is not harmful even. But some of the food increase the problem. So that food you have to avoid, like say bread, cereal, chips, cookies, coffee and coke, beer, wine, and mixed drinks. Alcohol, good to avoid. Eggs, beans, high protein, and also milk or milk product, right? Dairy product, ice cream, cheese. Here, just compare and contrast in between three diseases: ulcerative colitis, Crohn's disease, and diverticulitis. All of three is a chronic inflammation. Like ulcerative colitis, inflammation, but location is defined. It is terminal ileum or rectum. Crohn's disease, inflammation and ulceration, often distal ileum and cecum, this area. Diverticulitis, inflammation and infection of bowel mucosa caused by bacteria, by food or fecal materials trapped in or more diverticula. So when you see extra sac formation, it is called diverticula. When inflammation of diverticular, we call diverticulitis. Most of the sign and symptom are same, but location of the pain is different. So ulcerative colitis, patient has an abdominal pain or cramping, but in the left side. Your patient complain lower quadrant pain, left lower, this area, because ulcerative colitis occur lower part of rectum, left side. But cone disease with abdominal pain, cramping, but right lower abdomen. Diverticulitis, acute onset of abdominal pain, often in left side as well. All of 3 patients has a nausea, weight loss, anorexia, and vomiting. Next question. A nurse is palpating a client pulse on inner aspect of his ankle or below the middle malleolus. So which pulse is the nurse assessing or assessment? So what are the anatomical location? Ankle below the medial malleolus. Is it brachial? Brachial is the upper extremity, hand. Femoral, it is in groin. Posterior tibial and dorsalis pedis. The correct answer is posterior tibial. So what is the rationale? And what are the different location of pulses in the body? In this picture, we see, let me read first. To evaluate the posterior tibial pulse. So in this picture, this is the posterior tibial pulses. And this is the front dorsalis pedis artery. So if your patient has a peripheral vascular disease, like Raynaud phenomenon, Barger disease, diabetes complication, we will not get these pulses. Dorsalis pedis will be absent. Posterior tibial will be absent. So here they said inner aspect of ankle below the medial malleolus. So this is the bones here we called medial malleolus. The nurse palpate medially in the anterior cubital aspect to evaluate the brachial pulses. So here is the brachial pulses. Brachial pulses, and also you see midway between superior iliac spine and symphysis pubis is assessed the femoral pulse, and along the top of the foot over the its steps evaluate the dorsalis pedis arteries here. So before to go next question, I want to recap the temporal artery. We have to check in the corner, right? Just up the eyebrow, upper eyebrow. Facial artery, we have to check in the angle of the mandible. Then carotid artery, usually in the neck, just medial to the two and below the angle of the jaw. And we do not palpate both carotid artery in the same times. Then brachial artery, just medial to biceps tendon, this area. Then radial artery, it is medial and ventral side of wrist. You see, next one is called femoral artery, this area, below the inguinal ligament, or we can say the midway between symphysis pubis. So symphysis pubis is this area, and anterior superior iliac spine is, yeah, is midway. Then popliteal artery, it is popliteal fossa, we called. The patient should be prone with the knee flex when we examine this pulse. Next one, posterior tibial, behind and slightly inferior to medial malleolus of ankle. So these bones we called middle malleolus. And last one, dorsalis pedis artery. It is medial side of dorsum of foot with foot slightly dorsiflexed. Next question go. Why should the nurse avoid palpating both carotid artery at the same time? Why would avoid? Number one, the nurse cannot assess the pulse accurately unless she palpates the artery once at a time. Number two, palpating both arteries at one time may cause transient hypertension. Number three, palpating both arteries at one time may cause severe bradycardia. Number four, palpate both arteries at one time may cause severe bradycardia. So what we learn from here? We learn when we examine the carotid artery, do not palpate both sides simultaneously or in the same time. Why we do not do this? Because palpating both arteries at one time may cause severe bradycardia. So why should you avoid palpating both arteries at the same time? The rationale said the nurse must palpate the carotid artery one at a time to prevent severe bradycardia and impairment of cerebral circulation. The nurse must also remember to avoid massaging the carotid sinus located at the bifurcation of the carotid artery. The resulting bradycardia cause lead to carotid arrest. So in this picture, this is the common carotid artery, one left, one right. We do not examine both sides simultaneously or same time. Here showing this the carotid artery ultrasound. Here showing the carotid artery in this two sides. And in this picture showing carotid artery blood clot formation. This is a normal flow, but here clot and blockage knee. And also in this picture showing dissection develop, right? Let me recap it. The nurse cannot assessment the pulse unless the palpate the artery one at a time. When you palpate both arteries at one time may cause transient or may cause severe bradycardia. Right? Next question. Which statement regarding the heart sound is correct? Number one, S1 and S2 sound equally loud over the entire cardiac area. Number two, S1 and S2 sound fainter at the apex than at the base. Number three, S1 and S2 sound fainter at the base than at the apex. Number four, S1 is loudest at the apex. S2 is loudest at the base. So what are the correct answer? Correct answer is S1 is loudest at the apex and S2 is loudest at the base. Okay, this is the point we learn from here. And there are two heart sounds, S1, S2. S1 produced because of closing of mitral and tricuspid valve. S2 is produced because closed of aortic and pulmonary valves. But examiner asking what location you can best hear the sound. S1 sound is the loud sound is loudest at the apex of the heart. It sounds longer, lower, and loudest there than S2. S2 is dub sound, lub dub. And S2 is loudest at the base. It sounds shorter, sharper, higher, and louder there than the S1. So in this picture, and this picture can talk, showing aortic and pulmonary valves, tricuspid and mitral valves. S1 we call lub, S2 we call dub, lub dub. So S1 is the best heard at the apex. Apex is here, right? S2 is the best heard here using the, also we use the diaphragm of the stethoscope. It is, we can use the bell of the stethoscope and we can heard in the base, right? So this is the apex beat in the fifth intercostal space. So it is the guitar, and guitar, we can make a sound here or here. This is the guitar with body, which is the sound is amplified, right? And sound is better to hear. So the heart, the sound is produced in the valves, mitral, tricuspid, aortic or pulmonary, but this chamber, like a guitar, sound is vibration, sound is amplified and best heard in the apex, in the ear apex, S1, but S2 best heard in the base. Next question. A nurse is assessing or assessment a client who has a rash on his chest and upper arms. Which question should the nurse ask in order to gain more information about the client rash? Select all the types. So when you ask the question to figure out the diagnosis of the disease, always ask the leading question, relevant question. You do not ask any irrelevant or too much questions. So usually, like a patient came to you with a skin rash, you can ask me, is your skin is itching? So itching is really a common side effect of all kind of rash. So it is a relevant question. Now you can ask, does it have a clear edge? Or if your rash has a clear edge or cut-off point, the pattern or the cause of pretty light, you can easily figure it out. Or you can ask, does your rash is burning? So it is a relevant question that can help to narrow the things down and quite a bit. So like here, when did the rash start? So when patient came to you with a complication or complaint, you ask, what are the duration? Like, I am your patient, I have a fever, I can say, I have a fever for 3 days, right? So duration is important. Number 2, ask the allergy to any medication, any food or pollen. Very relevant question. So some people has an allergy to medication, adverse effect, and skin rash start. And some people has allergy to food or pollen. Very important question we could ask. How old are you? It is not a question related to the skin rash. Anybody can affect. Number 4, what have you been using to treat the rash? So it is the medication history, right? Number 5, have you currently traveled outside the country? Very good question, because some geographical areas, some kind of pollen or some kind of ticks or flea or some animal can bite and skin rash possible. Number 6, do you smoke or do you drink alcohol? We never hear that anybody drinking alcohol and skin rash causes, or cigarette smoking is not good. Cigarette can cause cancer, but it is not related to the skin rash. The correct answer is number 1, when did the rash start? Number 2, are you allergic to any medication, any food or pollen? Number 4, what have you been using to treat the rash? Number 4, have you recently traveled outside the country? Right? So why this is the correct answer? The rationalists say, when assessment a client who has a rash, the healthcare provider should first find out when the rash began. This information can identify where the rash is in the disease process and assist with the correct diagnosis. The healthcare provider should also ask about the allergies, because the rash related to allergens can occur when a person changes the medication. Like if you have a penicillin allergies, right? Or eat new food or come into the contact with agents in the air, such as pollen. Some people has a pollen allergies. The nurse needs to find out how the client has been treating the rash, because treating the rash with topical ointment or taking oral medication may make the rash worse. The nurse should ask about the recent travel history, because travel outside the country exposed the client to foreign foods and environment which can contribute to the onset of a rash. Although the client age, smoking, drinking habit can important to know, this information would not provide further insight to the rash or it, it can cause the rash. So if you have any question, you can email me. I will assist you. A nurse is assessment a client's abdomen. Which findings should the nurse report is abnormal? First one, dullness over the liver. So liver is a solid organ. It would be dull. It is natural, right? Bowel sound occur every 10 seconds. Is it not abnormal? Shifting dullness over the abdomen. So your abdomen will not contain any fluid. So dullness is not normal. Number 4, vascular sound over the renal artery. Definitely it is normal. So what is the abnormal? Out of 4, they say shifting dullness over the abdomen. So you see, this is the abdomen. These are not the sign of pregnancy. This abdomen full of fluid, and we said the ascites, right? So fluid dullness with shifting dullness, like here, it is more common if patient has a liver disease. It is common if patient have ascites because of liver disease. So you see, this is the abdomen full of fluid, right? And this is the abdomen. When patient change the posture, fluid is moving to the down because of gravity. It is called shifting dullness. So shifting dullness is a clinical sign that may indicate ascites. Ascites means fluid in abdomen. The presence of fluid build up in abdomen. It can be identified in a physical examination where a care provider tap the abdomen to listen for change in resonance. This test is not always effective, as it can sometimes a false positive or may not work as well in the patient with a significant fat deposit, but ultrasound can help to diagnosis, right? So here I said the rationale, the shifting dullness over the abdomen indicate ascites and abdominal findings, dullness over the liver, bowel sound occur every 10 seconds, and vascular sound over the renal artery are normal abdominal findings. Next question. A nurse using a stethoscope to auscultate the client's chest. Which statement about a stethoscope with the bell and diaphragm is true? The bell detects the high-pitched sound best. The diaphragm detects the high-pitched sound better. And number 3, the bell detects the thrill. And number 4, diaphragm detects the low-pitched sound. So what is the bell? What is diaphragm? It is important to know. Here showing the parts of stethoscope. This too is called earpiece and this is the tubing, and this is the stem, and this area we call chest piece. Chest piece has two parts. One is diaphragm, this area, and one is called bell. Examiner asking about the bell and diaphragm, and correct answer is the diaphragm detect the high pitched sound best. What are the rationale? The diaphragm of a stethoscope detect the high pitched sound best. The bell detect low pitched sound best, and palpation detect the thrill best, right? So again, before to finish, I want to tell you, let's work together to help you pass the NCLEX. And if you have any question, you can left in my email. I will answer, and I'm happy to assist you.